I can't see you.
Oh, okay, great.
Okay. Okay, without further delay, that your last paper, IDS versus DDS, it's like booming, following a lot of dentists here download this paper and have thousands of viewers videos discussing this paper because it was implemented for the last few years that IDS is a must, and your paper showed that there is other options, and I'd like to discuss that with you. So do you think that that your paper really give that you could do a DDS and have the same result from IDS, or you have another option?
No, a paper can show, of course, it's not a clinical trial, it's like a in vitro study. But anyway, it's a better way for us to really like focus on the things that we like to observe. And one of the things was exactly that, like if we like cure the adhesive before luting, like indirect or semi-direct restoration, we're gonna have the same or even a higher bone strength than if we did the IDS before. So one of the main things of this paper is if you like cure your adhesive in the tooth before luting, you good to go. So in other words, let's say that you have a veneer and like a veneer prep. In this prep, yes, you expose lots of dentin. So if you're afraid of not fitting properly your restoration, like your veneer that you're gonna lute, you're gonna have a lower bone strength. So in that case, if you prefer to be more comfortable, like with the adaptation of your restoration, and you like to perform the IDS before taking the impression, and so you're gonna have by the end of this procedure a good outcome regarding the bone strength, right? But you could do the same thing, like you could make the prep, but before luting, because let's say in this situation you did not perform the IDS, you just made the prep and then you took the impression. But the thing is, before you lute your restoration, like your veneer in this situation, you need to thoroughly air thin the bonding and like cure it. And only after that, you're good to lute your restoration. Because if you just apply your bonding and you don't like cure indenting, you're going to have a very low bone strength in the dentin area, at least. Because for the enamel, there's no importance at all. You can apply the bonding, you can put all together and like cure only at the end of the luting procedure. There's no need to like cure before the luting of a restoration. But the problem is only with dentin. In the paper, you can clearly see in the microscopy images that we had there, like the ones that we show the different layers. You can see in the group that we applied the bonding, but we did not like cure. We only like cure during the luting procedure. You can clearly see like some voids and some cracks in the bonding layer. So that's the problem with dentin. If you apply and you don't like cure, you're gonna have this situation. So for sure, your bone strength is gonna decrease a lot.
Yes, actually, this is a fourth version of Bondontics. We have a 3 previous episodes. Once per year, we discuss different matter with adhesive. But on the contrary, I was the one they make interview with, and we have questions like that before, and I highly recommend. I can't understand actually, even in any other situation, that you put the adhesive, then the flowable, and then cure. Even when you are dealing with enamel. I know that dental is very crucial. That's why it gives you very low results, because actually bonding dentine, as we all know, is very, very challenging comparing to enamel for different reasons. No time for discuss now. And actually, it is most of our work in our group in Turku and your work in Leuven is about that. And that's why I really don't recommend. Do you recommend separate curing? I mean, you put the adhesive and then put the flowable and then cure for one shot in any other situation? I know there is maybe some concern about the adhesive thickness, but you could compensate for that by air thinning. No need to co-cure. Or what is your opinion regarding that?
Yeah, like especially if you're working with universal adhesives, like let's say that you're using this kind of adhesive for class 2 restorations. Ideally, you can use them so in class 2 restorations, or to be more like more clear, let's say that we have a deep box in the proximal area of these box 2 restorations. So for sure, we're gonna have only dent in there in the deep part of the box. So if you use universal adhesive, we know, following the literature, that there's the need to apply a flowable composite after you like cure your bonding layer. Because if you don't do that, your bond strength is going to be lower than you can achieve by just applying a thin layer of flowable composite there. So one of the strategy of like layering a class 2.
But you don't need to co-cure. I mean, you will cure them separately. You will cure the bonds then the flowable, or you mean you will co-cure them in one shot?
You like cure them separately, like first the bond, then after the flowable.
Yes, exactly. And your answer led us to one of the questions I was preparing. You use clear fill SE 2-bottle adhesive system, one of the gold standard. And do you think, because I discussed with many followers and even Professor Van Merbeek this issue, do you think that the current concept of simplified adhesive, universal simplified adhesive, everything is in one bottle, could really have the same result like we have from 2-bottle system? Or we really sacrifice the durability regarding, because that's the challenge.
Yeah, to be honest with you, like considering, like, let's say that instead of using the Clearfield SC Bond 2 for this study, let's say that we had used the like Squad Bond Universal Plus. I don't know how will be, like how would the results be, but I guess I would say that IDS would perform better than DDS.
Okay,
because
thank you.
because of the situation that I mentioned to you before, like we know that we need to apply additional flowable over the bonding layer for the universal adhesives in order to improve the bond strength. So I guess that there's
the resin coating is really helping relieving the stresses and improve the hybrid layer of universal adhesives. That's what you refer to.
Yeah, exactly. So I don't know how resin cement will behave in the bond strength, because I don't know. Actually, no one knows.
Veneer. Yeah, because we can't do that with veneers. Yes, you are right. So I think some papers are discussing decoupling with time. they refer to that you wait for maybe, they said 5 minutes. I never wait for such long after adhesive application before I continue my restoration. What is your review about that?
Yeah, to be honest with you, there in the biomat, we don't even discuss that. There's no, we don't see a reason for us to wait. Like we do what it's been done for.
They claim that the hybrid layer maturation need at least this time to completely be mature and don't be affected by the stresses regarding shrinkage from composite. That is the claim from this paper. Actually, we also don't do that in our researches because I think this paper is even very old and the adhesives nowadays is much more developed than back then, and I think that your maturation didn't need that much time, or else the companies will work on it. If that's an issue, the companies will work to reduce this time if this time is necessary, because you can't convince dentists to wait for 5 minutes. A friend of mine is teaching in Europe, and he said he barely convinced students to wait for seconds regarding adhesion. They said I mean, of course, 30 seconds regarding enamel. He said they just wash it after 10 seconds. They never wait. So if you ask dentists to wait for 5 minutes, no one will follow you.
Of course, it would be like very, very good to wait for quite a while, would be okay. But to be honest with you, I never had any problem like just applying my adhesive in the way that I should apply and following like layering my restoration or luting, as I showed you. Like one of the ideas of IDS is exactly that. Like they believe that if you apply your bonding before the luting procedure, you're gonna have enough time to maturate, let's say, to your bonding layer to be better, let's say, your hybrid layer. But we showed from our study that there's no difference at all if you do one or another, but you have to like cure your bonding before. That's the thing.
Yes,
so
completely accepting that. Yeah, there's some methods trying to improve the outcome of adhesive. One of them is to apply 2 layer, if you like a weak acid adhesive, like one I don't know, one from that one universal adhesive from Bisco, is that they apply and rotate for like 30 seconds and then apply another layer. Do you think that this could allow the universal adhesive to have the same result we have from 2 bottle system, or no, it's one layer is more than enough with good agitation?
Yeah, if you read like some reviews on universal adhesives, they say that of course if you rub your adhesive, considering there is a universal adhesive, even like for the clear fill SC that we use in our study, when you apply the primer or the universal adhesive, you'll be applying the adhesive itself. You need to gently rub on the dentin surface. So if you do that quite often, you will improve. Like let's say that you apply one layer and you apply an additional layer, will greatly improve your bone strength. This was something that we did in our study. Like instead of just applying a small amount of primer and kept rubbing for 20 seconds, we apply like in a well, let's say 1 drop in a well, and then I had the micro applicator. I wet my micro applicator in the primer, rubbed in the dentin. I took a little bit more from the well, rubbed again, a little bit more from the well, rubbed again, like more or less 4 times. So this, of course, helps your bonding, because in this situation, we are priming, we are preparing the dentin. The same goes for the universal adhesive. So if you rub or if you apply for a long period of time, you probably gonna have a higher bone strength. But for sure, everything that we are mentioning are like in vitro studies. If you're in in a clinical situation, sometimes like in gaining 5, 10 megapascal, maybe it doesn't matter. So it's only a matter of having like a clinical trial for you to really know for sure that.
Yes, thank you for referring that. Actually, that's what I have did exactly in my research after the vitro results. I have done like a 4 years clinical trial, but the problem with clinical trials is taking a lot of time. Like even 5 years of clinical trial follow-up maybe is not enough to see the degradation, especially in adhesive. And that's why dentists and companies can't wait all that time before modifying to a new technique. So that's really challenging in our work. But of course, we should for every new technique or a method or a material should work for have a very long clinical trial. That's why we could make sure this treatment is useful or not.
Yeah,
Okay.
dentistry is complicated. You know, like Pascal came with the idea of using the Optibond FL for sealing the dentin. That's why he came with the name IDS. But the concept was designed before. For I mentioned that in the paper, so it's not his idea. His idea was to use Optibond FL for doing that. And he started using it because he faced it like a complicated situation in the clinic. Let's say he liked to have a better polish preps. So by doing the IDS, he managed to solve this. And sometimes he faced like some situations that he need to, fill some overhangs before taking the impression. So in meanwhile, he performed the IDS as well, and basically that he defends that. And like one study like this one that we did, yeah, showed that that sometimes IDS or actually it showed that sometimes not everything that has been said it's the best thing that we need to do, like the thing that we need to follow. So this is something that is very complicated about dentistry. Like if you're a clinical, if you work like in a daily practice, you know what, let's say that there's something that you do in a daily basis that you can clearly notice that this doesn't work, so it's a matter of experience. So if you read one paper or another that says that this works and or the another thing doesn't work, but it's in a vitro study, sometimes in a clinical based situation it doesn't behave the same. So the only thing that will tell us if it works or not, it's time. Exactly what you said. And sometimes like having a clinical trial takes too much time, and it's too expensive, and you cannot like exclude several factors that might impact your results. So it's quite tricky.
Yeah, I'm with you on that. Okay, regarding fibers, short fibers like Everx and long fibers like Ribbon. I have met a colleague of you in Barcelona, and I know that you are starting even working on 3D printed fibers and 3D printed zirconia. Yes, that was very impressive work. And do you believe that let's discuss the short fibers first. The Everx. Do you believe that they are really beneficial or they need any dentine replacement composite could do the same without adding fibers?
Yeah, this is the tricky question. It comes exactly with what I just said. Like everyone is talking again that if you use fibers, like short or long fibers, you're gonna have like a higher tooth strength. Let's say your tooth will behave better if you hadn't used the fibers. But to be honest with you, we need to wait. Of course, there are some studies that show some promising results when using the short fibers. This is the thing that I am following the most. But to be honest with you, if really have a difference if you use or not in a clinical situation, this is something that only time will tell us, in my opinion, for sure.
Yes, I'm with you on that as well. Because there is the study. Some studies claim that short fibers improve the strength, as you said, and some studies claim that long fibers help. That you have, even if you have a failure, you have a favorable failure that doesn't affect the root. Unlike if you bond a post or something. But the durability and longevity of this technique lead longer clinical trial. Yes. Okay, if you are in a situation and in your clinic and in case of delayed dental sealing, you don't have the air abrasion system is working. Maybe you lack for powder or something. Do you think that you could do the same with the handpiece? You could just move the like a rough pair on your old composite, and then you could bond, or you will never have the same result you will have if you do that with air abrasion.
Yeah, we need to have in mind that not all dentists have the air abrasion in their clinics. So
Yes, exactly.
the thing that they can do is like decrease the speed of the handpiece and use a rough diamond burr, like going in a different directions, in order to make like a very rough surface. It
Yeah.
should work the same. At least this is what some paper mentions. So I don't see a problem at all by doing that. I think especially because you're gonna have a quite good like bonding in between the layers, like the resin cement and the IDS layer. But mainly you're gonna have like an enamel, in the surrounding of your prep. So your restoration is gonna be okay. I wouldn't worry about that.
Okay. Do you plan in the future to have like randomized, because Brazilians are very famous with long randomized clinical trials? Do you plan to conduct randomized clinical trials regarding IDS versus DDS
Yeah.
in Sao Paulo? You are now in Sao Paulo, don't you?
No, I am in Santa Catarina. It's a state down south. And here, unfortunately, our labs, our PhD program, it's not that strong when it comes to clinical trials. So unfortunately, I'm not enrolled in that. But of course, if I had the opportunity, I would like to have something like that we can compare, like Optibone FL, Clear FSC bonds, like Scott Bone Universal or any other universal adhesive, and so you can compare like in after a couple years to see the difference in between, like at least having like two restorations that you need to look like two onlays, one with DDS, another with IDS. I don't know, so you can compare both. So this might be a good idea for a study. But as you said, it's quite expensive and it's not easy to be done.
Yes. Okay. And in your discussion, how do you envision a collaboration serialization of immediate detail sealing surface into future protocols? As you mentioned in your discussion, do you really think that incorporation of serialization in the bond could further improve the long-term stability of the adhesive?
Yeah, because when you observe, like, what is the concept of IDS is to have, like, basically you have a resin composite in there, right? Or resin based material in there. So when you're gonna lute using a resin cement, basically the concept is that you're performing like a repair in that area. So it's the same goal for when you have like a class 1 restoration, then instead of taking out, you just like to repair one part of the restoration. So if you follow some studies, some of them mention that salinization will improve the bone strength for that repair. Some others says that it doesn't improve, but it doesn't harm as well. But the other problem is the contamination with the surrounding tooth structure, because this is something that is not mentioned. At least I'm not aware of that, because once you apply the silane, you cannot apply only on the resin that you like to. You apply in certain part of your tooth as well. So if this decrease the bone strength, this is something that I actually don't know, but I guess not, since universal adhesive has silane and other components that doesn't harm the bonding.
Yes. Okay. Now I will look at the questions that is in the comment. So please, anyone want to share us any comment, just write down. Here, Dr. Abdel Nasser said that some people said that one of the groups, the delaying was just 30 minutes, and you consider that a DDS delayed until sealing.
What do you mean 30 minutes?
He refers that one of the groups that you wait for only 30 minutes.
No, I can't.
He said group 1.
Yeah, but we did not wait for anything. We ranked directly. I can show you here. Let me try to look it up. I have like the last presentation.
Okay, of course.
Here. I'm gonna try to show you here. I don't know if you be able to see. So the first group is the. Can you see, Omar?
You.
Yep.
See.
So we did not wait for anything. We just prepped the tooth.
Yes.
We prepped the tooth. We left there in the incubator. Like for every tooth, we always leave before in the incubator, or at least 30 minutes. but we did not apply adhesive at all. We didn't apply anything because the idea of leaving in the incubator with in a 100% humidity flask is to keep the tooth close to the temperature of the mouth, like close to 37 Celsius degree. So that's the idea of prepping the tooth and keeping the incubator before. So this is what he mentioned. But we did for every single group in this study, and for all the studies that we do, like when it comes using tooth for the group. You know, if we use teeth like to prepare any group in biomat, we always do that. Like when it comes to bond strength tests, like microtensile or share bond, it doesn't matter. Okay, so this is for every group of this study.
Okay. I think that's all. That's all the question I have in mind. Do you like to share with us any other thing regarding your paper?
No, I'm open here, you know, Omar. If there's anyone who likes to reach me out and likes to ask me anything, you can share my Instagram, or even I can share with you my email. You can share with them. I'll be very happy to answer everyone.
Thank you. Thank you very much, Dr. Renato.
All right. You like to ask me something else, Omar?
No, thank you very much. And I will highly recommend for anyone to want to further discuss anything regarding the paper to directly, as Dr. Renato said, send him a message, and he is a very kind, helpful dentist. And I also refer to them in the post that Dr. Renato, one of the few, is very, very skilled clinician, actually. But you have to watch his Instagram, not Facebook. You will find a very, very interesting cases.
Yeah. If you like me to have a course in whatever, let's have a course, Dr. Omar. Let's create a course for anterior composite restorations. This is something that I love working. You know that I have the course there in Canada as well as Brazil.
Yeah. Yes, maybe we could have a course in anterior composites in Egypt soon, maybe.
Yeah, that would be great.
Of course.
And of course, we can talk about several things, not only in anterior restorations. This is something that we discuss for sure, because every time, like, dentists like to ask something that it's beyond the subject of the course, because everybody works in the clinic, so they have questions, so they ask me frequently. Yeah, that's which is great for sure. And it's been a pleasure, Dr. Omar. Thanks a lot for the invitation.
The pleasure is mine, of course.
Yeah, it's mine as well.
Thank you. Thank you, Dr. Renato.
Thank you, Dr. Omar.
Thank you.
I don't know, where are you right now? In Egypt?
Yes, I'm in Egypt, and I will move to Finland for the next year by the end of this month.
No. Great. Nice. Yeah. No, we'll be in touch.
Of course. We'll be in touch.
Have a good afternoon, my friend.
Yeah, have a good afternoon. It's 1 a.m. here in Egypt, so we'll go to sleep now. Yeah.
Yeah.
Yes, thank
here
you.
it's 8 at night.
Yeah. Thank you.
Thank you.
Have a good day. Thank you.
Ciao, ciao.